So welcome everyone. My name is Sarah Sarelson and I'm the Executive Director of the Wyoming Children's Trust Fund and Prevent Child Abuse Wyoming. It is Child Abuse Prevention Month and there have been a ton of activities and awareness proclamations and events across the state. So thank you for participating and bringing awareness to a very critical piece of the work that we all do for children and families across the state. Today's webinar, I am very excited to bring to you. We're going to keep an eye on the waiting room and just let people in as they are coming. And so before we get started, I do want to ask if everybody would put, if you haven't already, put your name, where you're from in Wyoming, and where it is that you work in the chat box so that we know where everybody is tuning in from. That would be wonderful. Today's presentation is from one of our very special interns who has spent the year with us here at the Wyoming Children's Trust Fund and has spent some significant time researching postpartum mental health and how that is how it affects people in Wyoming and across the nation. And so she's going to share with us quite a bit of information that I think is really important for us to know as we're thinking about how we support one another, how we support those who we work with and those who we come into contact with. So I will go ahead and turn it over to Tennille. And thanks so much, Tennille, for being willing to share this information with us today.
Thank you, Sarah. Hello, everyone. I just wanted to thank you all again so much for joining us on this webinar today. So like Sarah said, my name is Tennille. I'm a senior at the University of Wyoming in the Department of Social Work. And this year I've had the privilege of being one of the interns here at the Trust Fund and Prevent Child Abuse Wyoming. And that has been really wonderful. And Sarah mentioned I got to spend a lot of time researching this, which I was very interested in. So that's been wonderful, and I hope it's helpful today. So today we will be talking about perinatal mood and anxiety disorders, which we call PMADs. We'll talk about their symptoms and prevalence, the outcomes, national and state data, risk and protective factors, and then I'll be sharing some resources at the national and state level. So let's begin with the definition of perinatal mood and anxiety disorders. This is an umbrella term that includes what we often think of, such as postpartum depression or anxiety, but it also includes other mood and anxiety disorders during this time. So the term perinatal means around birth. So we'll mostly be talking about postpartum today, but it does include pregnancy as well. And this is an important topic because women are more likely to experience one of these than any other complication associated with childbirth. And before we really begin, I want to address gender differences in relationship to PMADs. Up until recently, people have really only talked about and researched women's experiences with them. But in the past few years, that has started to shift a little bit, and more research has been done on fathers' mental health during this time period. The research is showing that men do, in fact, experience these, and that it has similar implications for the infant and the family as a whole. So with that being said, I think it's important to include that in today's discussion. There is still a lot more information about women's perinatal mental health, and this webinar does reflect that, but I've tried to include the data for men as much as I can. So now we're going to move into symptoms and prevalence for mothers on the next several slides, and then we'll talk about it as best as we can for fathers as well. So postpartum depression is the most common, so it's the one that we have the most research and data on. In the research and throughout this presentation, you'll see two different rates for postpartum depression. One's around 20% and the other's around 13%. And the reason for that is the 20% prevalence refers to both major and minor depressive symptoms, whereas the 13% refers to major depressive disorder. So I wanted to clarify that as we get into it. The symptoms include feelings of anger, fear, and guilt, a lack of interest in the baby, appetite and sleep disturbances. And these sleep disturbances are more than what's normal for having a new baby. Difficulty concentrating and possible thoughts of harming oneself or the baby. The second most common PMAD is anxiety. The prevalence of this is about 11%, and the symptoms include being worried or fearful, feeling very nervous, and having recurrent panic attacks, which involve shortness of breath, chest pain, heart palpitations, and things like that. Depression, anxiety do also often co-occur, but it is more common to have anxiety and not have depression. But most new mothers that have postpartum depression would experience these anxiety symptoms as well. The next one we'll talk about is bipolar mood disorder. And there's bipolar 1 and bipolar 2. And they both involve two phases, a low and a high, or a depressive phase and a manic phase. The difference between them is that with bipolar 2, the manic phase is less extreme. So the depressive phase is what really stands out. And because of that, bipolar 2 can often be misdiagnosed as postpartum depression. But the prevalence for this is around 3%. And like I mentioned, there's periods of severely depressed moods and then periods where the mood is much better than normal. But it can also include rapid speech, little need for sleep, racing thoughts, high energy, delusions of grandeur, impulsiveness, and in the most severe cases, it can involve delusions and hallucinations. Next is obsessive compulsive disorder. So this also occurs at about 11%. And the symptoms include obsessions, which is persistent or intrusive thoughts, and they're often related to the baby. And then compulsions to address those things. So that's doing things to reduce those fears or obsessions. And then we also see avoidance and a sense of horror over those. So as an example, a new mother may have obsessive, intrusive thoughts about her baby being injured, whether that's by herself, someone else, or accidentally. And then her compulsion may be to go through the entire house and get rid of anything sharp or any other object that she deems dangerous. And as a disclaimer, it is fairly normal for people in general, including new parents, to have intrusive thoughts pass through their minds, but that's all they should do. They pass through. For someone with OCD, they're not able to get those thoughts to go away, and they often understand that these persistent thoughts are not normal, and that's why they experience this sense of horror over these obsessions. And then PTSD. We know that PTSD can happen following traumatic events, and trauma could occur at really any point in the perinatal period. So during pregnancy, a complication such as severe preeclampsia could increase a woman's risk of PTSD. And then during delivery, there's honestly a lot of things that could be traumatic, but an example would be like having to have an emergency C-section. And then postpartum, a trauma could be like having to have a baby go to the NICU or something like that. And then women who have experienced previous sexual traumas are at a higher risk for developing perinatal PTSD. And it occurs for about 9% of new mothers. And then the symptoms include things that we typically see with PTSD, like re-experiencing the trauma in things like nightmares and flashbacks, also avoidance of things that they associate with the trauma, so people, places, and then persistent increased arousal. So things like irritability, difficulty sleeping, hypervigilance, and an exaggerated startle response. And then lastly, we'll talk about psychosis. Psychosis is the most rare PMAD with a 0.2% prevalence. The symptoms include delusions, hallucinations, irritability, hyperactivity, decreased need for sleep, significant mood changes, and poor decision making. And Unlike people with OCD who know that their thoughts are bizarre, people with psychosis are experiencing a break from reality and the delusions feel very real to them. And of people with perinatal psychosis, there is a 5% suicide rate and a 4% infanticide rate. Um, so obviously, we want to see prevention and treatment for every PMAD, but with psychosis especially, it's imperative that they're diagnosed and treated as soon as possible. So now we're going to talk about the symptoms and prevalence for fathers. I wanted to start by showing this chart. I think that part of the reason why women have exclusively been focused on for so long is because since their body is going through pregnancy and labor, we've always known that their hormones are changing. But recent studies have also shown that men experience some hormonal changes during pregnancy and postpartum as well, which I thought was really interesting. And you can see here that testosterone and cortisol decrease while estrogen and prolactin increase. And this is believed to help prepare the father for the postpartum period and to promote bonding with the new baby. But we know that hormonal shifts can impact mental health, and now we know that fathers are vulnerable to this as well. So, despite the growing research, fathers' perinatal psychological well being is not routinely assessed and therefore remains less systematically identified and treated than that of the mother. You may notice that bipolar disorder and psychosis aren't included on this slide, and that's because there have been very few cases of men experiencing those specifically in the perinatal period. Bipolar disorder in the postpartum time matches the natural prevalence, and as far as I could find, there's only ever been one case of paternal postpartum psychosis in the US, so it is extremely rare. But for depression, the symptoms may present slightly differently in fathers, where we see an increased irritability, indecisiveness, and a restricted range of emotion. And the rate of depression postpartum is around 10%, which is 2 times higher than the natural prevalence for men. And it peaks between 3 and 6 months postpartum. Um, About 4% of new fathers were diagnosed with generalized anxiety disorder, but 18% reported having anxiety that felt pretty severe, but it didn't meet the diagnostic requirements for a disorder. So I thought that was interesting, and I think we do tend to see that. And then for PTSD, um, in fathers, it involves a lot of the same symptoms that it does for mothers, but it also often includes a lot of self blame and guilt, as well as isolation, and often alters desires or plans for future children. And this occurs for about 5% of new fathers. And then OCD I thought was really interesting. The rate of postpartum OCD is only 1.8%, which is the same as the natural prevalence for men. Um, but it's 4% in the third trimester. So that's when OCD peaks for men, which I just thought was interesting. So next, we're going to discuss some of the outcomes of PMADs. And before we talk about how PMADs impact child development, we'll look at an overview of infant development generally. During the first 5 years of a child's life, the brain is developing very rapidly, so the most significant determinant in the infant's health is their relationship with the primary caregiver. Infants exist and develop within the context of these relationships. So, when caregivers consistently meet the needs of the infant develops a secure attachment to them, and this allows the infant to learn behaviors such as exploration, regulation, and organization. And either parent experiencing PMADs jeopardizes this attachment, which jeopardizes the infant development. So here are a few practical examples of the way that PMADs can affect a new family. So the effects can begin in pregnancy. Recent research has looked at how maternal mental illness during pregnancy affects the uterine environment for the developing fetus. And it has shown that depression during pregnancy is related to premature brain development in the baby. Another thing that a PMAD can affect is maternal facial expressions. during the postpartum period, mothers experiencing PMADs tend to make atypical facial expressions to their baby, which can affect the baby's development through learning those nonverbal cues. Um, PMADs can also lead to misinterpreting infant cues. Mothers with anxiety specifically tend to perceive more negative emotions in their baby. They often feel like this negatively reflects their parenting, which undermines kind of the healthy bonding cycle they'd otherwise go through. And then in response cycles and feeding and sleeping cycles, we see almost this snowball effect of PMADs. Um, Caring for a new infant is challenging even in the best circumstances. So, although things like crying and fussing are developmentally typical for a baby, they're not enjoyable for any caregiver. But it can be even harder for a parent with a perinatal mood or anxiety disorder to respond to their child in this state. Um, and then if the infant isn't being responded to, they get more fussy, and then it makes responding even more difficult. And it can become this cycle that's increasingly more and more stressful. And we see something very similar happen with feeding and sleeping cycles. These are two of the most challenging aspects of caring for a newborn, even when they're going well. A parent having a PMAD, anxiety specifically, is associated with sleeping and feeding patterns being more unregulated. And the quality of sleep that babies get is important to their brain development since our brains do so much while we get restorative sleep. So that's one thing it affects. But also, if the baby isn't getting quality sleep, then neither are the parents. Um, and then sleep deprivation exacerbates PMADs, and PMADs exacerbate sleep deprivation. So again, we kind of see how this can very quickly become a really stressful experience for parents. Um, and then several studies have found that PMADs affect the child's development, and some outcomes include poor neurosynaptic development, impact on language and motor development, lower cognitive scores at 4 months, nonverbal communication delays at 14 months, less social and emotional competence during toddlerhood, and then behavior challenges from infancy through adolescence. And increased aggression is specifically seen when it's the father that has a perinatal mood or anxiety disorder. So now we'll talk a little bit about the rates in the United States and in Wyoming. So again, a lot of the information is on postpartum depression, so that's what this map is for. Unfortunately, Wyoming does rank fifth from the bottom in the states that we have data on. And whereas the national average of major depressive disorder is around 13%, Wyoming's prevalence is over 17. And then this graph shows the trend in maternal postpartum depression from 2014 to 2021. In 2014, the US rate was around 12%, and Wyoming was around 14%. So now with them being around 13 and 17%, it does seem as though there is a gradual increase, but that's why we're here today. We're the people who can make a difference and hopefully see these rates start going in the opposite direction. Um, so a big disclaimer on this slide. We do not have real data on the number of women in Wyoming who experience each of these individual PMADs. Like we've talked about, a lot of them just aren't very well documented. But I wanted to give you a ballpark estimate. So I took the total number of live births annually, which is around 6,300, and I calculated how many women would experience each of these if our rates are the same as the national average. So there's about 6,300 new mothers and 20% have postpartum depression. That'd be around 1,150 women. So again, these are not real statistics. They're estimates from me doing math. So do take them with a grain of salt. But in theory, that's about 700 women in Wyoming who would experience postpartum anxiety and OCD every year. About 190 who would be experiencing postpartum bipolar disorder, 570 that would experience PTSD, and about 10 with postpartum psychosis. So now we'll talk about some risk and protective factors. There are some common risk factors for mothers and fathers, such as low socioeconomic status, a history of mental illness, as well as unsupportive or stressful relationships. And then other risk factors for mothers include adolescence, low educational attainment, pre and postnatal complications, delivering a preterm baby, and exposure to interpersonal violence. And then fathers are more at risk for a PMAD if the mother has postpartum depression, if the pregnancy was unintended, and if he's experiencing severe sleep deprivation. But the number one protective factor against PMADs is social support. So oftentimes the presence or absence of risk factors are outside of the parent's control, but they don't have to be deterministic. Social support is something that people can cultivate in a way that we can help perinatal parents. So social support comes in two main forms, which is emotional and practical. Emotional support is what's provided by people who can listen to concerns and give helpful advice. An example of this would be if a postpartum parent was feeling overwhelmed and they were able to call like a long distance friend and talk about how they were feeling. If their friend can provide encouragement and maybe help them work through what it would take for them to not feel overwhelmed anymore, this would be like an emotional social support. And then practical support is what's provided by someone who can help do things and provide information. So, an example of this would be someone coming over to bring them food or to do their dishes. And then the informational support could look like other parents who have had similar experiences or the information that they could get from professionals. So, these are a few types of supporters that can come around families in the perinatal period. Of course, family and friends are often our main support system. Support groups are also really valuable during this time. And postpartum families can gain a lot of support from different professionals, like their doctors, doulas, visiting nurses, lactation consultants, mental health professionals, and social workers. And regardless of how many risk factors are present, social support can help prevent perinatal mood and anxiety disorders from ever occurring. But let's talk about the interventions and resources for if a perinatal mood and anxiety disorder does occur. So, there are a few different approaches to interventions, and they can also be combined. So, the first is pharmacological. So, an example of this would be a parent with postpartum depression beginning to take antidepressants. Uh, this can be very helpful, although some parents do prefer to avoid this method due to concerns about compatibility with breastfeeding. And then this is obviously not one size fits all and something that each individual person would have to talk to their doctor about. Um, Another approach is psychological. So, common psychological treatments include interpersonal therapy, cognitive behavioral therapy or CBT, and psychodynamic therapy. And then there is psychosocial interventions, which include things like non directive counseling and those social supports. What's really cool is we also live in a time where a lot of information and resources can be found by individuals online. So, in the next few slides, I'll draw your attention to a few of those. The first one is Postpartum Support International. This is a large group that has a lot of information and resources. They provide support to families and training for professionals. So, their website is postpartum.net, which we can also drop in the chat. And some of the things that you can find on their website is their PSI helpline, which is just a way for new parents to call or text and get some support. They also have a provider directory where they can help people locate local resources. They have chat with experts. I think it happens once a week for mothers and then once a month for fathers. And they do have professionals who lead these calls and are just available for any questions. Then they also have peer mentor programs, so parents that have had a perinatal mood or anxiety disorder and come through it can meet with people that are currently postpartum and give them encouragement and advice. And then they have online support groups. Anyone can sign up and just go and learn from others that are in kind of the same stage that they're in. Um, their postpartum planning is something that you can do while you're pregnant, and it's to make a postpartum plan for that period. And it has things like, you know, who are you going to call if you are experiencing any of these things, and um, a lot of things like that. And then they also have specialized support resources. So, like an example of this would be like a parent with a disability. They have like unique resources and information for a lot of different groups. And so then the next thing we'll talk about is man therapy. So this is kind of continuing with our inclusion of father's mental health. Man therapy, though, is not specifically related to or associated with pregnancy or postpartum. It actually started as a suicide prevention campaign for men and has grown into more of a general mental health campaign. They work to decrease stigma and increase help seeking behaviors in men, and they do this uniquely through their humorous content. So, this is one example of something you would see from them. Get a few things off your hairy chest. Another one that I can remember off the top of my head is like sometimes the man just needs a pork shoulder to cry on and things like that. And if you visit mantherapy.org, you can see what they offer, including mental health assessment and connections to providers and resources. And then Wyoming Children's Trust Fund actually purchased the state license to their marketing materials, so anyone in Wyoming can use them. This includes like social media posts and designs for posters and things like that. So if you're interested, just let Sarah know and we'll get you the link to those materials. So again, this isn't specific to postpartum, but certainly can include postpartum fathers. And then as for some Wyoming specific resources, Wyoming Hand in Hand is the nurse home visiting program. So nurses visit families during pregnancy and the first 2 years of the child's life to provide information and support. They help parents understand and bond with their babies and also discuss a wide variety of topics like nutrition, physical activity, budgeting, and problem solving. And they also screen for postpartum depression and intimate partner harm. It is free for qualifying families in every county in Wyoming. And I was actually just reading a study where they looked at the effects of nurse home visiting on the rates of postpartum depression. And in the control group, there was about a 19% prevalence. And in the group with the home visiting, the rate was only 8%. So that's just one study, but there is other research on it as well. And nurse home visiting seems to be one very promising intervention for PMADs, which makes it so exciting that it's available everywhere in Wyoming. And then next we have Wyoming Parents as Teachers. Parents as Teachers is a free parental support and child development program. It serves family from pregnancy through the child's third birthday. And a certified parent educator meets with the families in their homes or in their communities, whichever the family is more comfortable with. And they get to know them and their goals. And then they focus on activities that promote parent-child bonding and helping the children learn. So they discuss this within 4 major domains of development, which include language, motor, social emotional, and then cognitive skills. And they currently provide support to families that are in Albany, Laramie, and Sweetwater County. So those are just a few online resources and a couple resources that we have in the state. I know that many of our individual counties have their own ways of supporting families as well, and that work is so appreciated. So that is all the information that I had for you, but I'd love to hear your thoughts and I'll try to answer any questions that you may have. So feel free to come off mute or put your questions in the chat.
Hey guys, it's Josephine. I have my twins here kind of squawking, so if they squawk over me, my apologies, but they don't follow any commands yet. So I just wanted to
No
say
worries.
thanks for doing this because perinatal mental health is, um, it obviously plays a big role in our communities, for better, worse, and it's everywhere in between. And there's not a lot of discussion about it, right? It's still kind of like an icky taboo subject for a lot of people, and especially moms, because mom shame is so real. We don't want to admit that we're having a hard time or doing things wrong, or our house is a mess, or our kid's a mess, or we don't even like this today. So, anyway, I just think it's a great topic. So, I just really appreciate all the information you shared, especially too about how it impacts fathers, because boy, howdy, you know, I'm married to a man, and so I'm really raising four boys here. I'm just kidding. But it's really good to know for him too that the things he's experiencing are real, trackable. There's data, um, and it just really validates his experience because he's on a roller coaster of his own. So anyway, thank you.
Yeah, absolutely. Thank you for bringing that up. I know fathers are often referred to as like the support partners, and um, I think that's absolutely true, but it's also true that they need support themselves oftentimes. So,
Thank you for being an optimistic social worker person who's going to enter the workforce. We need you.
thank you.
I think too, it's just really cool to see the data. Um, I'm a mom and I was a child protection caseworker with babies, and that impacted my mental health because you're just scared. Your anxiety is just different when you know the child protection realm. And so I think I was definitely really nervous and scared to ever admit that I was struggling with postpartum depression anxiety.
Yeah.
Um, and so just realizing, oh, intrusive thoughts are normal to an extent. And like a lot of people experience this. I think the more awareness we can get out there, the more people are not going to feel the way that I did. So thank you.
Yeah, thank you so much for sharing that. I think
Mhm.
it's so important to, decrease the stigma around it because if that's what's preventing people from getting help, um, yeah, it's really just doing more harm. So, yeah, thank you for bringing that up. And in the chat, I saw Renee, I believe, posted the link for Wyoming Hand to Hand. So thank you for doing that. All right. Well, if there are no other questions or comments, then we'll wrap up today's webinar. If there are other questions that you think of later, feel free to reach out to us. We will also put this recording on our YouTube page, which is called Wyoming Family Resource Center Collective. But thank you all so much for joining us today. And Sarah, is there anything else you